Hello, everybody. My name is Jenny Muir, and I am the chair of the Global Alliance Health and Wellbeing Month and a board member of Global Alliance. Welcome. Welcome to today's webinar, Mental Health Perspectives, Personal, Local and Global. I'd like to begin by acknowledging the traditional custodians of the land from which I'm joining you from today, the Gadigal people of the Eora Nation in Sydney, Australia. I pay my respects to elders past, present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples and Indigenous peoples from across the globe joining us today. I also want to extend a warm welcome to those that are joining us today with a lived or living experience of mental health conditions. Your voices and perspectives are invaluable in shaping this conversation and driving meaningful change. Today, we explore how individual, local and organisational change actions can contribute to global progress in mental health. Thank you for all participating in today's important discussion. Now I'd like to hand you over to Sylvia to continue our conversation.
Thank you, Jenny. Good morning, good afternoon, good evening, everyone, and welcome to this important webinar hosted by the Global Alliance for Public Relations and Communications Management. I am Sylvia Arto, Vice President of the Global Alliance from Paris, and it's my honor to open today's discussion. We are privileged to be joined by distinguished representatives from the World Health Organization, WHO QualityRights initiative, as well as leading voices from across the public relations and communications industry. Today, we are here to address a pressing issue: mental health and well-being in our profession. As public relations and communications professionals, we are often expected to navigate high-pressure environments, manage complex stakeholder relationships, and deliver results under tight deadlines. This reality takes a toll on mental health, making it essential that we work collectively to support each other, challenge stigma, and advocate for real change. And it's with great pride that we announce today the Global Alliance collaboration with the WHO QualityRights initiative for 2025. This collaboration represents a shared commitment to strengthen mental health awareness, promoting best practices, and ensuring that public relations and communications professionals have access to high-quality support and training. The WHO QualityRights initiative is globally recognized for its efforts to advance human rights-based approaches to mental health, and through this collaboration, we aim to three things. First, increase access to the WHO QualityRights self-guided e-training available in multiple languages to enhance mental health literacy within our profession. And this free-to-access self-guided e-training provides multiple models for PR and communication professionals to register, access, and learn from during 2025. Also, we want to encourage Global Alliance organizations to adopt workplace mental health policies, empowering leaders to create supportive and sustainable environments. And finally, to develop a framework that integrates mental health as a global priority for the profession, ensuring lasting impact. This collaboration is a major step forward in ensuring that mental health is not just an individual responsibility, but an industry-wide commitment. And we reflect on our commitment to mental health. It's crucial to recognize that mental well-being is shaped by multiple layers: personal experiences, local environments, and global initiatives. And this is precisely the focus of our next section: mental health perspectives, personal, local, global, presented by our esteemed colleagues from the WHO QualityRights initiatives. This presentation will explore how individual choices, workplace culture, and global mental health frameworks intersect, and how every level of action contributes to positive change. So it's now my pleasure to introduce Dr. Michelle Funk, Head of Policy, Law, and Human Rights, WHO, and Dr. Celline Cole, Consultant for Policy, Law, and Human Rights, WHO, who will share valuable insights on how we can bridge the gap between personal responsibility, organizational leadership, and systemic progress. So we are excited to listen to you first, Michelle. I leave you the floor, and I encourage the audience to engage by sharing your questions in the chat throughout the session. Go ahead, Michelle.
Great. Thanks so much, Sylvia, for your kind introduction. It's a pleasure to be here. Thank you, Jen. Thank you, Sylvia, for the invitation to speak at this webinar. I wait for Matthias to put on, I won't wait, but Matthias, if you can just put on the title slide as I introduce the presentation, we'll stay there. First of all, good morning to everyone and good afternoon, or what it may be in your country. We're really pleased to have this opportunity to introduce the World Health Organization's Quality Rights Initiative at today's webinar, and to also kick off our collaboration with the Global Alliance in order to advance mental health in your profession. So it's really good to see that mental health is being elevated as a priority on the Global Alliance agenda. And, you know, we know that there will be an exciting announcement to make about a large number of country associations joining. Is that happening after, Jen? Just to...
No, you can do it if you wish.
Okay, so we're thanks. So, well, we've heard the good news that as part of the collaboration with the Global Alliance and the World Health Organization, there'll be 18 country associations who are on board to roll out the Quality Rights e-training on mental health amongst their members. So many diverse countries: Philippines, Indonesia, Turkey, Italy, Zambia are just some of them. This is super exciting, so it's a perfect time to tell you a little bit more about Quality Rights and the training. But also to mention that through this collaboration, we really anticipate large-scale participation in the e-training, which is going to foster greater awareness and understanding of what it is to have a holistic approach to mental health. And this is not only essential, but it's a priority to reduce stigma and discrimination, both in the workplace and in the broader community. I also want to say that with your exceptional communication skills, no doubt everyone has that, that's a requirement for your profession, you're all uniquely positioned to advocate for and amplify the key messages of today's presentation, ensuring that they reach and resonate with a wider audience. So this is something that we're tasking you with once you leave this presentation. So what we want to do here is give you a short overview of the WHO Quality Rights Initiative, followed by a deep dive into the e-training itself, which is already starting to have enormous impact globally. And we hope by the end of the webinar, you're going to want to register and promote it through your work, through your networks and workplace. So can we just move to the second slide? Great. So look, I just want to start the formal part of this presentation by saying that we do with some positive messages. We are seeing renewed awareness and growing recognition of mental health and its importance at a global level. Much of that stems from the recent COVID-19 pandemic and our shared experiences of the negative impacts of that Lockdown, I'm sure you're all aware, social isolation, loss of income, worry, anxiety, and so on. So there are many negative impacts, but so many people experience them that it gives us a better understanding of what is contributing to poor mental health and what's important in promoting positive mental health. I think we still need to say funding towards mental health is way too low. But the increased attention is still counted as good progress globally. And what we've seen is more public awareness campaigns, more destigmatization efforts, and this has contributed to a rise in people seeking help. It's also contributed to a rise in, more digital technologies as well that has the possibility to increase access and reach. Not good on its own, but certainly good as part of a whole range of options of interventions to provide people. And also importantly, I want to say that we're seeing a growing number of initiatives and actions moving towards a holistic, person-centered, rights-based approach in mental health. They're big words, but what we mean here is that it's an approach that builds on the idea and acceptance of diversity, uniqueness of individuals and responding to that uniqueness in delivering support and care, as well as the importance of inclusion and making sure that people aren't discriminated against, marginalized and left out of the community. And so this is the new and transformative agenda for mental health that is really much needed. So I would like to go to the next slide now and just talk a little bit about some of the pressing issues and barriers that we need to address with this approach. Try to make it quick and snappy, but essentially high levels of stigma and discrimination, major problems still in our communities, as well as the disempowering messages that many people receive when they enter the mental health services. As well as from the communities and society as a whole. And basically, the message that people are getting when they get a diagnosis is that you are now no longer really able to contribute to society, to actively participate, and that there is a deficit in you. And this is leading to further marginalization and exclusion. And we have to turn around that attitude and change that attitude. People with mental health conditions who are experiencing challenges have a lot to contribute. And these problems do not need to hold people back, and they do not define individuals. We also see a lack of access to community mental health services. This is very urgent to address. There are very long waiting times. Another issue is services and communities placing too much emphasis on diagnosis, use of medication to manage symptoms, rather than taking a holistic approach to treatment and care and support that includes a broader range of lifestyle and physical health, psychological, social, and economic interventions. They're all important pieces of the picture. Just to mention a few others, I'm not the focus, but there's institutionalization. It's still happening everywhere around the world. That has to change. It's very damaging for people to be put in institutions where they stay for short or longer periods of time. We see way too much, or any form of coercion is not acceptable and is harmful for people's mental health. Elimination of coercive practices in mental health must stop. And we see also denial of the right to legal capacity. So you're diagnosed with a problem, and quite often that leads to denying people to decide about their own treatment and other aspects of their lives. So this needs to change as well. So all of this is the background to why we developed the WHO QualityRights Initiative. And now I am handing over to my colleague Celline to introduce the overall objectives of the initiative and the e-training which we are collaborating on. Over to Celline, and we move to the next slide. There, no, you're already on the next slide. All right.
Thank you, Michelle, and also hello and welcome from my side to everybody in the room. So yeah, now before I actually launch into the QualityRights e-training, it's important to provide some broader context of where it sits as part of the overall QualityRights initiative. So QualityRights is WHO's global initiative to address the pressing issues that were just mentioned by Michelle earlier. It aims to improve the quality of care and mental health services, to promote the human rights of people with mental health conditions and psychosocial disabilities. And importantly, our work is aligned with the latest international human rights instruments and obligations, and most importantly with the UN Convention on the Rights of Persons with Disabilities, and in short, CRPD. Yeah, and on this slide, you can see the main objectives and areas of the work of QualityRights. And we work in 4 main areas. Firstly, we aim to build capacity to combat stigma and discrimination and promote human rights and recovery. We also work to support countries to actually create community-based services and supports that promote people's human rights and promote inclusion. We also support persons with lived experience and civil society actors to fully and effectively participate in all aspects of decision-making around mental health. And finally, the last area of work is to reform policies and legislations in line with the CRPD and international human rights standards. Next slide, please. Yeah, okay. So yeah, today in this webinar, we want to focus on the QualityRights e-training, because this is what's being also promoted in the collaboration with the Global Alliance. So let's take a closer look at the e-training itself. As Michelle mentioned, it's a tool that has been already very impactful and beneficial for a wide variety of stakeholders that are interested in delving a bit more deeper into the topics of mental health, recovery, eliminating stigma, and all from a holistic and person-centered perspective. So what are the benefits for you as a learner? What can you take from the QualityRights e-training? First of all, you will be able to understand better and improve your own mental health and well-being. It can also help you to better support family, friends, members of the community who experience mental health issues or emotional distress. You will gain valuable knowledge and very practical skills to tackle stigma, discrimination, abuses, and coercion. You will also learn to provide mental health support to people who are recovering from physical health or mental health conditions or crises. And also you will gain skills to actually really actively involve people in their own treatment, care, providing tools and empowering them to overcome physical and mental health challenges. Next slide, please. So the training is actually open to everyone. It is very interactive, it's self-paced, it's a really fun learning experience. and it's currently available in 16 languages, including English, Spanish, and French, but also Turkish, Filipino, Italian, and many more. And because the QualityRights e-training can actually be completed online in your own pace, it has the potential to actually reach hundreds of thousands of people within and across countries, and to actually achieve change on a very large scale. Next slide, please. Yeah, and we are also very happy to report that the e-training is already engaging large numbers of participants, and that the evaluation of the e-training that we're doing on an ongoing basis has shown highly significant and large-scale changes in attitudes among people who have already completed the e-training. And these changes are aligned with reduced stigma and discrimination and a rights-based approach. So we're very happy to report that the e-training actually has a large impact on people and is actually producing change on a large scale. And already we have a learning community of about, it's 130,000, even better than what's shown on the slide. It's a slightly older number, but now we have 130,000 people enrolled and over 70,000 people who successfully completed the e-training. And what I think is even nicer to share than p-values and significance levels is to what we're actually hearing from the learners on the platform, what they are saying. And we hear that they are finding the training really rewarding, even life-changing. So I've included some of the quotes that we've gotten from users of the platform. I will just read a few. So, I loved every bit of it. It's so interesting, captivating, very short and straight to the point, educative. I'm glad I chose to do it. And very insightful, especially on what recovery looks like for different people. People must be allowed to have options on what they feel works best for them and define their own healing journey. Next slide, please. So what I'd like to do now is to take a quick look at the content of the e-training platform itself. It covers 6 core modules and 2 advanced case study modules. Next slide, please. And just to give you a quick idea of the content of each of the modules, the first module on human rights gives a general introduction to what human rights actually are. It provides information about human rights violations, how these affect diverse groups, and it shows how stigma and discrimination really contribute to the denial of human rights and the direct negative impacts of that on mental health. It also presents actions of what can be or actions that can be taken by everybody to defend human rights. And then the second module goes on, it's on human rights, mental health, and disability. And it, first of all, teaches the learner about the different ways that disability has been defined in the past, like the different models of disability. And it also very concretely explores what is stigma, what are the stereotypes around mental health, what is discrimination, what violations do people with mental health conditions experience. And it also introduces to the UNCRPD that was mentioned earlier as well. Next slide, please. There's also another module on legal capacity, which introduces you to the concept of legal capacity, and it demonstrates the importance to ensure that all people are actually able to make their own decisions. It helps you to understand how supported decision-making and also recovery plans, advanced plans can be used to avoid coercive practices and to ensure that people are actually able to exercise their right to legal capacity and to make their own decisions. The fourth module focuses on coercion, violence, and abuse, which are also pressing issues that Michelle mentioned before, and on concrete strategies to end these practices in services. And both of these modules, they also contain a very fun and interactive case analysis where you will be able to actually apply your knowledge and analyze and answer questions around real life scenarios. Next slide, please. The next module is on quality standards and community inclusion, and it provides very concretely information about the key standards that actually should be met within mental health services and supports to promote a good standard of living, and also highlight some issues around the institutionalization, the need for deinstitutionalization, and to create more community-based mental health services and supports. And the final module is on mental health, well-being, and recovery. And it explores the right to health, how good mental health and well-being are key to achieving the UN Sustainable Development Goals. And it explores what recovery actually means and why it's so important to adopt a recovery-oriented approach in services and supports. Next slide, please. Yeah, and once you have completed all of these 6 modules, you will receive this official certificate from the WHO. Next slide. Yeah, and now what we'd like to do is to show you a short video that actually captures the essence of the training far better than what I could explain in this short time that we have together. So if you could share the video, perfect.
Thank you, Matthias.
Thank you. Yeah, so from Michelle and my side, a big thank you for your attention, and we hope that you all got a good idea of the Quality Rights Initiative and the e-training, and that you're hopefully all interested and motivated to sign up to the e-training. And yeah, later on, the ways and links and QR codes to access the training will be shared with you. And now we look forward to your questions and comments.
So just to kick off, we've got a couple of sort of initial questions for both Michelle and Celline that I hope you don't find too sort of complex. One of the ones was we're really kind of trying to connect with the tangible benefits so people can understand the training, as well as the importance of collective destigmatization and awareness raising. Can you highlight the tangible benefits of empowering yourself personally and professionally with knowledge of mental health conditions and experiences, and maybe in the context of how this can connect and have a beneficial flow-on effect for people's workplaces and communities? Michelle,
yeah, maybe I'll start with
Yep.
the first part of the question, like about like what are the benefits for you, like in individually, and then we'll take it from there. So basically, the training and also like knowledge about mental health conditions and about mental health and well-being in general, it will help you to understand what is mental health. You will get a better connection to your own mental health and well-being. What does that mean for you? How can I look after myself? How do I recognize maybe signs that I'm emotionally distressed? What can I do, like, to actually get a better understanding of that, which can already be very, very valuable. And secondly, it will help you to like get knowledge and skills to support others around you, and that in a way that actually that you listen to what is going on with your family member, your community member, your friend, to be there, support them in a way that actually respects their dignity, to focus on really like what does the person need, rather than imposing something, and to actually support and understand others better, and to improve your relationships also. It's what we hear in the comments of the e-training. You saw that there are discussion boards where people share their experiences, that they actually really take something for their personal lives, their relationships, that they see improvements in how they interact with family members, partners. So this would be something on an individual level to share.
Let me just quickly jump in there as well. I think building also on what Celline said, the training is going to help address self-stigma as well, because people who have mental health issues and challenges, they then start to doubt themselves. They have their own self-stigma, which is really important to overcome. And the other thing that we're seeing is, as well, concretely, is that people are standing up for their own rights. So they're not, they're less willing to be subject to, going to a service, being told that they must obey what the doctor says or what a nurse says. They're able to say, look, be more confident in what they want, what their needs are, and what needs to be addressed. So there's a lot of self-empowerment and more confidence in having a more equal dialogue with others around them. I think that's really important. So, so Celline said, it helps people understand mental health for themselves in their own lives. It helps people address and be more supportive to the mental health problems of people around them, addresses stigma, self-stigma. It also addresses all the challenges that I mentioned at the beginning of my presentation. So creating a different sort of culture, creating a different sort of mindset around mental health, bringing in a more holistic approach to the services. Once you start to multiply the e-training at community level and with a different mindset, the services then start to change as well. They become more holistic, less focused on just diagnosis and treatment. So you're building a completely different approach in the community and also in the workplace. So the culture of the workplace changes. There's less stigma and discrimination, more openness to talk about the problems, more flexibility, more motivated staff. These are the changes that you can expect at individual, community, workplace level. But I also want to say that you can't expect the training to change everything. I mean, you can see that capacity building and the e-training is one component, important component of our work, but you still need policy changes, you still need legislative changes, you still have to have a focused effort on services. At the workplace, you still need to look at, many of the things we know affect mental health. So, work-life balance, role clarity, physical conditions where people are working, control over workloads and schedules and so on. So I'll stop there. And I think there's a lot of material to discuss. Sorry.
Michelle, given that so many people have completed the training, let alone just enrolled, is there one or two examples that stand out to you of feedback that you've got from the learners where they've communicated some significant change that they've noticed either personally or systemically? Something that's really kind of made you sit back?
There are many things. I mean, overall, Celline presented the impact from the sort of research that we've done, and it's huge attitudinal change. But we've also seen there's the individual qualitative feedback where people say, this is life-changing. My relationship with my wife or husband has improved. Okay, these are the individual level responses. Or we've had, this is the best mental health training I have ever received. Or this is really eye-opening. I never looked at mental health in this particular way. Or we have comments from staff of services, for example, I will never use coercion again. I didn't know how harmful it was. I understand now. I understand there are different ways to approach mental health in a much more supportive way. So these are the individual comments that are coming, which are reflected in our research and our more scientific findings. So which are reduced coercion in the services, people being more empowered and understanding and demanding that their rights are respected. The staff and community members saying, wow, their attitudes about how they've approached it before has changed. So there are many different levels of impact and evaluation that are just reinforcing each other. Yeah.
So thank you so much. We are so excited about this collaboration, and we can see at a personal and professional level, at a community level, and of course, public relations and communications professionals are in rooms where we have influence on decision making. So at a more systemic level, we are hoping that momentum can build. We'd like to thank you so much for joining us. We've got a special section that we want to sort of move to do a special announcement for the Global Alliance. But if you would like to stay with us for this, that would be absolutely lovely. And to Sylvia, and we throw it over to you.
Yes, thank you very much, Jenny. And thank you, Michelle and Celline, for your insightful presentation. Thank you for sharing your expertise on this important topic. And building on the insights we have just heard, together with Jenny, we are now proud to launch the Global Alliance, How We Are Working Mental Health and Wellbeing Snapshot Report. This report provides a critical assessment of the state of mental health in our profession and highlights the urgent need for systemic change. I want to share with you some of the key findings. For example, 78% of public relations professionals report experiencing high stress. 46% say that their mental health has deteriorated in the past year. 64% feel the organizations do not provide sufficient mental health support. And only 32% feel comfortable discussing mental health at work. The leading stressors include unrealistic deadlines, client pressures, and work-life balance struggles. These findings confirm what many of us already know, that mental health challenges in our professions are not isolated incidents, but they are systemic and they demand urgent action. And this is why at Global Alliance, we think it is a very important topic to be addressed globally together. Jenny.
So we are proud to launch this snapshot report for all of you and for all of our members. It is an essential step in addressing the mental health challenges faced by our profession globally. By no means does it represent all of our experiences, because there is a significant challenge in the way that we measure and report. In response to these challenges, the Global Alliance is committed to leading industry-wide change by establishing a global benchmark for measuring and reporting mental health in the public relations and communication profession globally. We are also committed to expanding access to mental health resources and training, such as the collaboration with the WHO QualityRights initiative announced today. We're encouraging leadership-driven workplace transformation, ensuring that mental health is recognised as a strategic business priority. And we're supporting industry-wide advocacy efforts to break down stigma, normalise mental health conversations, and implement inclusive policies. The responsibility to address mental health does not rest on individuals alone. It is shared commitment. It is a shared commitment across our entire profession globally. We urge all public relations and communication professionals, agencies, consultancies, and organisations to prioritise mental health by engaging with the resources and strategies available through our collaboration with the WHO QualityRights initiative, as well as all of the free resources that we have curated for you on the Global Alliance website. Together, we can build a healthier, more sustainable profession, one where every individual has the support they need to thrive individually, personally, and professionally. Please, the snapshot report has just been published on the Global Alliance website as I've been speaking. So please download and share amongst all of your networks. Please share across your social networks as well. We will come and make more announcements over the coming weeks as to what are the next steps. But of course, the immediate step is to enrol in the WHO QualityRights initiative e-training. Now, I'd like to thank you all for joining today's webinar and for being part of this critical conversation. Your engagement and dedication to mental health advocacy are what's going to drive meaningful progress in our industry. But before we conclude, I'd encourage you to register and download all of the resources that I just mentioned, including the links to the resources and the registration for the WHO Quality Rights Initiative. All of these tools are designed to support you in fostering positive change within your organisations and communities. Once again, thank you for your time and commitment and shared vision for our profession that prioritises mental health and wellbeing globally. Take care, and we look forward to continuing this important work together.
Thank you very much.
Thank you, everybody. Okay.